Thank you for joining Cancer Support Community Atlanta for this program. Please visit our website, cscatlanta.org, for a complete list of live and recorded events. We invite you to sign up for our newsletter to stay connected to all future programs.
So a couple of objectives. We're going to talk about the importance of good oral care before, during, and after treatment. Also, we're going to identify ways to manage nutrition impact symptoms that impact oral intake and understand a variety of tools available to help ensure that you can maintain adequate oral intake as you go through treatment. So first off, when we think about digestion, we may think about digestion in our stomach, but really digestion starts in your mouth. So when the first time that you put, even before you put something in your mouth, your brain sees the food, you might smell the food. So digestion isn't just in your stomach. It actually kind of starts before you eat. Your mouth, your saliva secretes enzymes to help start breaking down the foods once you put them in your mouth. So like I just said, it kind of starts with the smell. The smells help to trigger the salivary glands and brain to know that one is about to eat. Chewing with your mouth and teeth, that helps to start saliva production. And there are 5 tastes: sweet, salty, bitter, sour, and savory. Then in your mouth, in your tongue, things like that, there are actual nerves that help you to feel the spiciness of hot foods and the coolness of mint. So even though we taste them, those feelings that we get are also part of digesting as well. Again, saliva glands begin to digest your food by secreting an enzyme called amylase that helps to break down starches, and lingual lipase that helps to break down fats. And then I just think this is an interesting fact, but typically the average person produces 2 pints of saliva per day. So those are just, we don't think about that a lot, but I just thought that was an interesting fact. So there are some, general oral care tips. This is a great recipe. This baking soda, warm water, salt mouth rinse. It's 1 teaspoon of salt, 1 teaspoon of baking soda mixed in with 2 cups of warm water. This homemade baking soda rinse can help with things like dry mouth, thick secretions, and just general oral care. If you can using this to rinse your mouth out before bed or right when you wake up in the morning, rinsing before and after meals. You obviously wouldn't use this whole recipe at one time, but again, it can be helpful to help keep your mouth clean in between meals if you have a bad taste in your mouth, things like that. So this recipe can be utilized in a lot of different ways. Brushing your teeth regularly with a soft bristle toothbrush and fluoride-containing toothpaste. Sometimes the soft bristle brush can be a little bit easier on your gums if you have any mouth sores or soft spots in your mouth. The softer bristles won't be as harsh. Flossing at least once a day if your gums are not irritated. If you're being treated for thrush, so if you have a yeast infection in your mouth, it's important to replace your toothbrush every few days or sanitize it by soaking it in mouthwash for 30 seconds. The reason being is that if you are brushing your teeth, some of that thrush or yeast may get on the toothbrush, and so you don't want to reintroduce that back into your mouth when you're brushing. Also with brushing, we think about brushing our teeth, but it is really important to brush your tongue as well. to reduce irritation in your mouth. Alcohol is an irritant. It can cause pain and burning. So a lot of times we'll recommend avoiding mouthwashes that contain alcohol. So looking for an alcohol-free mouthwash. These aren't as harsh on your mouth. And then also avoiding cigarettes, pipe smoking, and chewing tobacco. Those are other irritants in the mouth as well, or can cause irritation in your mouth. One side effect that going through cancer treatment can cause is dry mouth. Some people, you may hear it referred to as xerostomia. So the first thing you can do is choose soft and moist foods, using gravies and sauces when possible. So like, for instance, if you had a piece of dry, like baked chicken, if it was too dry, then adding like a gravy on top of it, or instead of just a plain hamburger patty, adding gravy or tomato sauce like on a meatloaf are going to be easier to combat the dry mouth. Because when you have a dry mouth and you eat something like a cracker or a piece of bread or something, it's just going to become even drier. And when you try to eat dry food, it just kind of becomes a gummy ball in your mouth. Sipping on liquids throughout the day can help, just to help kind of moisturize your mouth. So carrying a water bottle with you, or any kind of fluid during the day can be helpful. Preferably not caffeinated fluids during the day, because those can dehydrate you over time. So like a water, a juice, anything like that. Again, avoid tough meats and dry foods as you can. Sometimes people have to learn the hard way and figure out what works for them and what doesn't. Sucking on hard candies, especially sugar-free hard candies, can be helpful. The sugar substitute that you get from xylitol, which is a sugar substitute in sugar-free hard candies, can actually help coat your mouth. These hard candies also, especially if they're sour or tart, may help stimulate some saliva production. Popsicles, especially now that we're kind of in the summertime, popsicles are great ways to get some more fluids, or like an Italian ice, things like that. And then also sucking on ice chips is fine to help kind of with your dry mouth as well. But really the tart, sugar-free hard candies can be helpful. Again, we already talked about good oral care, so just providing oral care during the day. And then there are a lot of products out there that are made for dry mouth. They typically help to coat the inside of your mouth to help it feel more moist. So Xylamelts are a adhesive, like lubricating tablet that you adhere to your tooth or on the inside of your gum. And over a couple hours, they release xylitol, which kind of helps to coat the inside of your mouth. Biotine is a group of products that does a lot of different options. They have dry mouth gels, dry mouth sprays, and then Lubricity and Moisture are two other options that are out there. Again, it may, I think playing around trying to find a product that works for you is what helps. These products kind of help you to manage dry mouth in between meals, so that you end up not being so dry when you go to eat. And then again, using a humidifier by your bed at night is helpful. Sometimes that may be a little more helpful during the winter when people typically run the heat in their house that makes dry mouth worse. But using the humidifier, placing it directly next to you at your bedside table to allow that cool mist at night. Sometimes people, if they have sleep apnea, they'll use their CPAP machine that has a humidifier as well. So again, just remember, if you are using a humidifier, place it by your bed at night, not across the room. So the next symptom we're going to talk about is mouth sores or mucositis. Sometimes again, you might hear mouth sores or you might hear mucositis. Mouth sores can be troubling because when you have a sore in your mouth, it makes you not want to eat. So some strategies for this are to use soft, bland foods. So thinking of like scrambled eggs. I use like overcooked pasta, overcooked rice, mashed potatoes. Sometimes, seasonings and spices can irritate the mouth sores, especially if acidic foods and beverages. So like an orange juice, a pineapple juice, tomato sauce. So instead of doing a spaghetti with a tomato sauce, you may need to do like a pasta with a Alfredo sauce, just to kind of help not cause your mouth sores to have more pain. Again, like with the dry, a lot of these things kind of overlap. So choosing moist foods, again, gravies and sauces if possible. Anything that's hard or crunchy may scrape or irritate an open sore in your mouth. So if you had a piece of like a waffle, for instance, putting a lot of like butter or syrup or jelly, things like that on it may help just to moisten down the kind of hardness of a bread. And then, yeah, you may have to also do like more cooked vegetables, softer fruits like a canned peaches, canned pears, things like that may not be, or a banana. Like cooked apples may be easier to eat than like a hard raw apple. So it's just modifying. You may just have to modify the food a little bit while you have irritation in your mouth. Sometimes people find drinking from a straw can be helpful because you're bypassing the irritated parts in your mouth. And so that can always be a strategy to try to stay hydrated. Again, ice chips can be helpful to suck on your popsicles, things like that. Sucking also frozen fruit like grapes or peaches, those can kind of, you can suck on them. The coolness can help soothe your mouth, and then they kind of end up turning like icy over time to where you can eventually eat them. Again, back, providing good oral care. This is where like the soft bristle brush comes in. We really found that the warm baking soda, salt water rinses can be helpful for the mucositis as well. Honey has been known to help with mucositis. So dissolving a tablespoon of honey in a cup of warm water and kind of sipping on that can help with the mucositis as well. Or if you wanted to do like, usually the honey would probably dissolve in the warm water best. So that's why it's suggested to do that way. There are, a couple products out there. I know physicians can prescribe something called, magic mouthwash. And there are a lot of different recipes for that based on what the physician thinks is best. That's, again, it's a prescribed medication, and it acts as a numbing, pain reliever. So it's something that we typically recommend to time around meals so that you allow, time it, 10, 15 minutes before you eat so that the medication is acting and taking the pain away. So while you're eating, you have some pain relief. And then that way it'll wear off by the time you finish your meal. So these products on this list are more so to help support mucositis. So to help it, help you kind of feel better, to help those mouth sores heal. One of those it's called a K12 or a Streptococcus salivarius. It's an oral probiotic. There was a study that showed people who are undergoing radiation to the head and neck area did these oral probiotic lozenges, again, the specific K12 strain, 3 times a day. They dissolved in their mouth, and that they had less severity of mucositis compared to the patients that didn't, the control group, or the patients that did not do the probiotic lozenges. So this could be something if you're on a chemotherapy that may cause mouth sores. Again, there are a couple brands out there, Now, NOW. I'll type these in the chat. Now brand and Bliss, BLIS, are 2 that you can get on Amazon. But those are available, again, just to kind of help reduce the mouth sores that can happen during treatment. Helios is another product. It's a glutamine and arginine mouth rinse. You mix it in like 15 milliliters of water. It's a powder, and you're recommended to swish and swallow morning and afternoon. It's the glutamine helps, and the arginine help with wound healing. So that's why the Helios is recommended. Helios is a little more expensive. It's around $100 per container of powder, and you get it from the Helios manufacturer directly online. Honey, again, we talked about honey. It's been known to help mucositis. That's probably like, your kind of more natural, affordable option. So 2 tablespoons per day. It can either be mixed in the warm water, or if you just want to take a tablespoon of honey and get it down, then that's fine too. Juven is another product. It's a flavored powder packet that you mix with 8 to 10 ounces of water twice a day. It comes in a couple different flavors, fruit punch, orange. I typically recommend people to get the unflavored product because then you can mix it with whatever works for you. Again, it's a wound healing product, so it's going to help your mouth sores heal. It's just recommended to not be used during radiation if you're actively getting radiation, to not use the Juven that. So it'd be something to use after radiation. Yeah. So, and thanks for adding, Laura and Pam. Thanks for adding to the chat. That's I appreciate y'all's feedback on what's working for you. So yeah, so that the Juven's after the lozenges, the Helios or the honey can all be used during radiation if you are getting radiation and they're causing mouth sores. So thick saliva is the next thing we're going to talk about. It can be considered like thick secretions. The thick saliva can be a result of your dry mouth. So what happens is when your body has really dry or is lacking saliva, what it does is it ends up going into overdrive to try to produce more saliva. And what it ends up producing is this really thick, ropey, gummy saliva that's hard to kind of cough up and get out. So there are a couple things you can do to help thin out the thick saliva until you've kind of gotten through that post-radiation or post-treatment phase to help you. So again, our oral care rinse with the baking soda and salt, utilizing that several times during the day, especially some people really doing this like right before bed and then first thing in the morning. Waking up first thing in the morning can be when our dry mouth or, your thick saliva has kind of like gotten stuck in place overnight. So really trying to get up and do good oral care in the morning to kind of clear things out is important. Trying to elevate the head of your bed. Again, a cool mist humidifier. Club soda and sparkling water. If you're able to tolerate those, the bubbles in the club soda and sparkling water can actually help break up your thick secretions as well. So kind of swishing the club soda around in your mouth and either swallowing it or spitting it out can be helpful. And then, the more fluids you pass through your mouth, the more you're kind of helping support those thick secretions. So really trying to push hydration. Again, sometimes people have found if you're able to tolerate it, the problem is if you have thick secretions, the pineapple, kiwi, and papaya juice may burn the inside of your mouth. So, but the pineapple has a enzyme in it called bromelain that helps to so it's like a tenderizer. And so, that's why the pineapple and papaya can be helpful to break down those thick secretions. But again, it's really based off of what you're able to tolerate. And again, we talked about the magic mouthwash. You know, it again can be used for mucositis if you still have some thickened secretions and pain with swallowing. It's the combination prescription, so that would be something you need to ask your doctor if it's appropriate for you. And then, like I said, biotin has a ton of different options out there. So some people find the spray works better for them versus the mouthwash versus the gel. Taste changes can be, a big barrier to getting adequate calories and protein and hydration in your diet. It's also referred to as dysgeusia, so you may hear somebody say that. But basically, for taste changes, choosing foods with tart flavors. Again, if you have mouth sores, these may irritate you, but tart flavors, pickled foods, marinating something in citrus prior to cooking it, putting lemon on your fish, things like that can be helpful to overcome a bland taste. Marinating foods. So marinating something in teriyaki, Italian dressing, things like that, just to kind of help infuse whatever you're going to cook to help give it an extra depth of flavor. We've talked about the sugar-free lemon drops, gum, or mints earlier for dry mouth, but they also can be beneficial for taste changes, especially in between meals. If we have like a lingering taste in our mouth, the sugar-free lemon drops, gums, or mints can help kind of overcome an off-putting flavor that may develop in your mouth. If water is boring, there are a million different ways you can flavor the fluids that you're drinking. So like either Crystal Light or the squirtable ones, things like that can be helpful. Seasoning foods. So really trying to get creative with what you use to season foods. It may not be that you want something with like a heat spice level, like pepper spice, but using things like onion powder, garlic powder, rosemary, oregano, things like that can be helpful. I always tell people too, like prior to having these taste changes, you may not have liked honey mustard, or you may not have liked barbecue sauce, but really experimenting with different flavors, different cuisines can help, where, the average person may just like use a little, dip of a condiment. You may need to really like slather your chicken in barbecue sauce or honey mustard or anything like that, just to kind of help give it some flavor. Again, eating frozen fruits can help because they typically are flavor-wise picked up, and then the coolness can help soothe your mouth. Finally, we're back to this like baking soda salt solution, using it before and after meals. I think a lot of times going into a meal with a clean mouth, and then, can help just kind of set your palate up for success a little bit, versus if you have an off taste in your mouth and then try to sit down and eat, it make things worse. If you are experiencing a metallic taste, we encourage people to use plastic, silverware, glass cups, and plates. We recommend people not cooking with cast iron. Sometimes the cast iron, or if you're cooking in like a metal vessel of any sort, the metallic taste can be heightened. And that's why we say like plastic silverware or like bamboo silverware, any kind of like non-metal, flatware, can be helpful. And then, not drinking out of a metal water bottle, trying to use glass cups, not eating off a metal plate, things like that can be helpful. So dysphagia is a term known as difficulty swallowing. So for this, if you do feel like you're having difficulty swallowing, from a nutrition perspective, you might have to modify your diet consistency. So instead of eating like a regular meal, you might have to downgrade to something that's like soft and moist foods. And then from there, you could downgrade to something that was like the consistency of like purees, like applesauce, pudding, soups that don't have chunks. But really, making sure that you talk to your physician, and express to them that things are becoming more difficult to swallow, because there are speech language pathologists that help with speech and swallow, and they can recommend specific tests to observe your swallow and see, also work with you to rehab your swallow, just to kind of make sure that you're safely swallowing, that food isn't going into your lungs, which is called aspiration, and that can cause pneumonia. So again, just kind of letting a provider know if you feel like you're experiencing difficulty swallowing so they can get you connected with a speech language pathologist. But in the meantime, moistening foods, again, maybe choosing like a softer food that's easier to slide down, going to purees. A lot of people may at this point need to supplement with like a protein shake. Like, there are a million different options out there, but just really, making sure that you're staying hydrated, because if you aren't able to, get enough fluids down, we just don't want you to get dehydrated. So again, speaking up, advocating for yourself, let somebody know what's going on. And then we can work as a dietitian, we can work with the speech language pathologist and kind of tell you how you can meet your calorie and protein needs if you are having to modify your diet at all.
Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org, or follow us on Facebook. We'll be sharing additional information on upcoming programs.